the average duration of treatment with metal braces is approximately 12 to 15 months. Anything less is a bonus. Metal braces are a type of orthodontic appliance, usually made of stainless steel. They're used to help straighten teeth and correct the position of jaw malalignment. They normally consist of 4 component parts: metal brackets, wires, special elastic bands, and metal bands. The cost of metal braces is highly dependent on the complexity of your bite. And whilst they are a cheaper alternative to aesthetic braces or aligners, the orthodontist will determine the cost of the treatment depending on the complexity of your bite. Metal braces work by applying a gentle yet continuous force on the teeth to move them into the new position. This consists of multiple stages and parts. The orthodontist will bond a special type of bracket with glue onto the front surface of your teeth. A wire is then threaded through the brackets, which applies a gentle and constant pressure. Special elastic bands are used to tie the wire onto the bracket, with timely adjustments approximately 6 weeks. The bone adapts to the pressure of the orthodontic appliance by moving the teeth into the new position. The length of orthodontic treatment depends on the complexity of your bite. However, the average duration of treatment with metal braces is approximately 12 to 15 months. Anything less is a bonus. Metal braces don't necessarily take any longer than other types of orthodontic appliances. However, it's highly determined on the complexity of your bite. However, as metal brackets are glued onto your teeth, they can straighten teeth in anything as little as 6 months. Normally, there's very little difference between the outcome of ceramic or aesthetic braces and metal braces. As long as you keep your teeth healthy and clean, there are relatively little side effects with orthodontic appliances. However, one of the biggest side effects is root resorption. Root resorption is when the tip of the root melts away slightly during the course of orthodontic treatment. The orthodontist will take a special type of X-ray to ensure the suitability of your teeth for orthodontic treatment. It's important to touch base with your general dentist to ensure your teeth are kept really nice and clean. Otherwise, you can end up with irreversible marks on the teeth that then won't go away. It's important to ensure that your gums are kept healthy to avoid any gum recession. And it's really important to remember, teeth have memory. If you don't wear your retainers at the end of your active treatment, the teeth are likely to slip back partly into their original position. Retainers are for life, not just for Christmas. Metal braces aren't painful. However, patients can report a dull ache after the adjustment of your orthodontic appliance. Nothing a little bit of paracetamol won't get rid of. Metal braces themselves do not directly plump your lips. However, given the bulk of the metal on the tooth, they can give the appearance of fuller lips. This reverts back to their original position once the appliances are removed. Titanium braces aren't necessarily better than stainless steel braces. However, there are a few individuals that may respond better if you're allergic to stainless steel. The most expensive type of braces are ceramic braces and aligners. Metal braces are often a cost-effective alternative. There is no one best orthodontic appliance. The orthodontist will decide what type of appliance is suitable for your type of bite.